We are a professional services organization focused primarily in the electronic patient record market. We also do some work with ERPs, but we have several different service lines that are broken down, starting with advisory services. That can be anything from software selection to standing up governance and a PMO, but also advising the organization during their implementation phase of an EPR. We offer implementation leadership and staffing. We have a big focus around training the end users and assisting them with adoption, supporting them at the time they come live for the first time. And then we have a security practice that advises the IS organizations around keeping their data secure. We do some penetration testing, things like that. In addition to that, we found that a lot of our customers who have gone live with an electronic patient record are finding the costs to maintain it are extraordinarily high, higher than they expected. We have a managed services offering for electronic patient record customers that can really reduce their total cost of ownership. We do things around adjusting their staffing model, but also implementing some process and governance as well to reduce the work volumes and ensure high value output for those types of activities once they're live. So we've really been successful in reducing that total cost in our managed services practice. The last service line that we have is around analytics. It's advisory on what they can do with the data that they've collected in their electronic patient record. We've seen a lot of success, and we have a sister company, ClearSense, that is a big data ecosystem, and it's using a Hadoop-based platform, and we're doing really neat things about ingesting data from all different data sources other than just the EPR. The EPR has historical data, and we're pulling in information that's off live patient devices, patient monitors, wearable technology, et cetera, and we're providing really good information at the point of care so that providers can make really good decisions and get ahead of possible incidents like code blues and sepsis, things like that. The people using our services, the groups are the IS organization, the IT teams at the hospitals, but also their customer, the operational leaders within the healthcare organization. I would say for the IT leadership team, they receive an advantage when they have a partner who's been in their shoes before, gone through an implementation and sat in their shoes multiple times in the past, have a lot of lessons learned. So we help guide them down a path that prevents them from making the same mistakes our leaders did in the past. It helps them make really good decisions, be really efficient with designing the system efficiently and effectively so that their customer, the healthcare providers, the nurses, the frontline medical staff have a good usability in the system and they have a good experience so that they can stay focused on what they're trying to do, which is take care of patients. So I would say that's probably the biggest value that we offer the IT team. The operational team members, in terms of getting used to change, I think change is the biggest challenge that organizations face when they're implementing an electronic patient record. And our leadership team really helps devise a strategy for communicating the change that's about to come, helps set expectations with the leaders in the different departments within the healthcare organization, and prepare them for what's to come so that it's not an extraordinary shock when they're experiencing the system for the first time. So we help settle the nerves, I think, and to get them comfortable and excited about what's about to come and the improvements it's going to have and the outcomes that they have for their patients. I think one of the biggest challenges is approved funding for the type of work that needs to be done and what the healthcare organizations are needing. The NHS has a lot of work to do, and securing proper funding to get that done has been a challenge, particularly for the suppliers to come in and do that work. The appropriate funding needs to be there. I think that opens an opportunity for organizations like us and pressures us to get creative on the way we solve the problems of the NHS. And I think we've done that at Optimum. I think we've, particularly in our managed services practice, we've found a really good way to reduce the long-term operational costs of maintaining the electronic patient record. We do this with tiered staffing across organizations, leveraging talent across organizations. It's something that an individual NHS trust is unable to do, but when we're able to leverage it across multiple trusts, that reduces costs. We also have a big focus in process and governance, in advising, in reducing the total work that needs to get done, and really focusing on things that are high-value changes. I would say that's probably the most impact. Have an open mind about some of the new ideas and steering away from the norm a little bit. Being willing to consider some untraditional approaches. Some of them may be enabling more remote work, accessing a talent pool. In the US, there's a lot of United States EPR vendors here in the UK, and there's a huge pool of extraordinary talent in the US. The travel expenses of bringing them here and leaving them here to do the work is kind of cost prohibitive. And so being open to changing maybe some staffing models within the electronic patient record implementation teams, but also support is a good way, creative way to reduce costs. So having an open idea to, having an open mind to those types of ideas. I believe that the biggest challenge they face is change management with their customer, the operational leaders. So the healthcare providers, it's a massive change. It's an opportunity to not only change their system, but change the way they do work. And it's a very, very big challenge to get diverse healthcare providers on the same page and get excited about the change that's about to come. So there's so much change involved in an electronic patient record implementation, and you really have to get ahead of that and be very good at communicating expectations and getting them engaged and involved in the decisions being made. I think that's the biggest challenge that CCIOs and CIOs face.